Good evening. My name is Kaylee Weber. I am the nurse working with the Newman family, uh, and I've gathered you all here so that we can have a discussion of her care. So thank you, PT, OT, Psych, and Dr. Smith for all being here today. Um, so I'm going to give a little bit of background on the Newman family, and then I'll go into my thoughts for how we should move forward for her cares. So Lacey is a 28-year-old female. She suffered a crush injury following rock climbing at Devil's Lake, and she needed a below the knee amputation. Currently, she her stump has not healed um, so fully, so she will need more time before she can be fit for her prosthetic. But she is working with PT and OT for ambulation for moving to the commode or the bathroom, and they're working with her up in her therapies. She gets 2 hours a day of PT and 1 hour of OT per day. And I was able to grab coffee with her husband, Tyler, and I wanted to just establish what are his feelings with everything that's happening, what are some concerns, and I want to talk a little bit about the health of expanding consciousness and how I think it relates to their case. So they're a newly married family. They are newlyweds of 2 years, and they have not started a family, but they planned on starting a family within roughly within a year was their timeline prior to this incident. So I'm going to talk a little bit about the theory of health as expanding consciousness. So this is um, a theory that the uh, how a person is able to find connectedness or their consciousness and how their health affects their feeling towards this. And it one of the main things this is rooted in is looking at the person as an entire person, not just them and their disease. So their health includes their disease, and it there's a large influence of a caregiver and how the caregiver will affect the healing process and the patient or the person's ability to find greater meaning and have connectedness with the world. So there are 4 different themes within this theory. I'm going to talk briefly about each. The first is the dyadic relationship, life patterns, influence, caregiver role, and responsibilities. So that's a lot of words, but way that I think of it is the caregiver. Um, there's going to in any relationship, there's going to be a natural um, split of roles and responsibilities, and when you introduce the someone being a caregiver, it will change how this dynamic works. This relationship is now, it'll change how mutual the relationship is and the communication of the relationship. So, something that Tyler stated that I think concerns me for this is, excuse me, he doesn't know how to be her husband after this happened. So uh, I'm concerned with that he doesn't know how to balance both being the husband and being a caregiver, which is a very valid concern for this type of situation. He is also a young man. Uh, they're under 30, and the fear of being a caregiver for the rest of your life, uh, but to someone that you thought was going to be mutually with you, is scary. Um, so it's a valid concern for him to have, and he's voiced his concerns. The next theme is the life pattern of caring for self and others was altered. So for this, um, the pattern of the caregiver's life is going to need to change. to provide the cares for the person they're caring for. And something that concerned me for this, what that Tyler stated, was he doesn't want to change his hobbies. He doesn't want to back off from what they like to do. Uh, but that's how he wants to spend, but he still wants to spend time with her. So I am worried that he does not want to adjust how he spends time with her. At least in the short term, she will not be able to return to rock climbing. And they also are very active. They run marathons, they like to be very involved and out doing things. And it is unrealistic in the short term for her to be doing that immediately. But it is still important that they spend time together and show their love for each other. So this is a concern of mine. Next, the life patterns of certainty and knowing we're limited. This was a very big concern for him. So this is just kind of what it says. Um, the life patterns of certainty and knowing are limited. There's a lot of uncertainty with how she's going to heal. There's also uncertainty with having children. Tyler stated uh, he was very excited to have children, but he worries if they'll be able to. He wants a big family and he doesn't know if that's ever going to happen. And uh, I think a realistic way to um, address that concern is to talk with them about starting a family down the line. And instead of their original plan of within a year, there's going to be a lot of change happening within the next year of their life following this event. Uh, she'll she'll need to continue to have PT and OT. I'm sorry, my cat is scratching me. She'll need to continue to have PT and OT for quite some time, and it will be difficult for her to um, adjust. And so adding family planning to the mix may be too much emotionally, but they are still able to have children down the line. And also giving realistic expectations for what she is able to offer in the dual care of a child and the safety of the infant going in and out of the crib, um, where she's at with her prosthetic and the steadiness, uh, what how if she's able to lift the baby, how is she able to lift them safely, what are they able to do. So having realistic expectations for what that will look like, I think, is very important for this family. The final theme I'd like to briefly talk about is the awareness of life patterns, giving meaning and new perspective on life. So um, this is a very major event that happened for both of them, and it is going to change how they view life moving forward. So, uh, uh, there was no specific statement from Tyler that had me concerned for this, but I think it's something we should be aware of moving on through the future, especially as the wife is healing. She, there are days where she's going to feel really good. PT is going well, OT is going well. She feel her leg isn't hurting. She's confident and happy. There are going to be days where everything hurts. She doesn't want to get up. She doesn't want to move. She doesn't want this to be her life anymore. And so offering support for both of those, I think, is very necessary for this family. So just briefly before we finish this call, I want to talk about ultimate goals for working towards the health and the development of of expanding consciousness for this family. And I think some realistic interventions that we can offer for them are um, discussing family planning. Uh, for PT and OT, I think it's very necessary for Tyler to be involved with, uh, even if it's a shadowing approach at the beginning, let him watch how you pivot her. How do you put a gait belt on? How do you steady her? What ways are you encouraging her to move forward? How do you help her balance? What do you assess for that she is steady enough to move? Um, what are signs that she needs to take a rest? Because she may feel really good. Maybe she has her prosthetic on and she thinks she's doing so well, but she's actually unsteady and she's going too fast. So, how can he talk with her so that she doesn't trip and then possibly hurt the prosthetic or emotionally hurt herself where she doesn't trust herself? So, I think PT and OT, letting him be involved and discussing what you're doing because he's going to be the person that's helping her when she goes home. Of course, you're checking her off, but for prior to discharge, but making sure he's aware and also what progression looks like and what are realistic expectations for any digression that may occur because that can be very discouraging for the patient and family if she has 5 great days and all of a sudden she's in a slump where she's in a lot of pain, she doesn't want to move. How can you encourage her to keep doing PT, keep following her OT? Also, for caregivers, I think realistic expectations for how often she should be bathed and showing him uh, how to ambulate her properly, how to wipe her and clean her, or letting her do it independently and allowing her as much independence as we can, I think is very important. She's a young woman and she's able to wipe herself. She's able to do a bed bath. She can wash her own hair. She may not be steady enough to stand in the shower, or maybe we can add a guardrail and assess if she's ready and steady enough on one leg. So there's assessments that need to happen with it, but encouraging both people I think is very necessary. And my final thoughts in conclusion is that recognizing both adaptive and maladaptive patterns as she's moving towards her understanding of her being. So the some adaptive things is showing gratefulness for being alive, being uh, present and involved with PT and OT, um, wanting to eat and keep up with her nutrition. And then some maladaptive patterns, depression. She may feel very sad, have low mood. She may be very flat. Um, she may not want to refuse PT and OT, not want to participate. She may even refuse meals, or she may refuse cares such as hygiene. And so I think it's realistic that for her to have small setbacks, but we want her to move forward. So when we see maladaptive patterns, trying to intervene in therapeutic ways, and psych, you will be the best to defer to for this. How can we establish trust with her and let her know it's okay to feel frustrated? It's okay to be angry that this happened. It's okay to be sad that this is what your life is. It's okay to be angry at your partner because you really want to get up and go to the bathroom right now, but he isn't able to stop what he's doing for the next 5 minutes, and you're frustrated or you're mad at him. So, how can we establish psychological support and emotional support? Because emotions are going to come up. Um, I also think it's very necessary for her to have a psych consult prior to discharge and trying to set them up with partner therapy because they need to work through some of this together, but also individual therapy for each. Thank you all for your time. I realize my time went over. Thank you for listening to me speak on this, and I'm happy to be working with you as a team. Thank you for your time.